Hi everyone. Good morning. Good morning everyone. Welcome to Center of Balance Life. I'm Szenan from Center of Balance, the acupuncturist and Chinese medicine herbalist. Good morning, good morning. This is New Zealand time, 7:15. New Zealand time, 7:15. Now if you're watching this live video, please say hello to me. Type in hi Szenan, something like that. Now today our topic is about back pain symptoms. So what are the signs of back pain? Is back pain just simply pain in the back? Pain in the back area? Where's back? We're talking about lower back, right? Lower back. It's just simple. We're gonna talk about what type of pain. Is it stabbing pain, achy, or stiffness? Stiffness is part of the back pain symptoms, right? So is the back pain area just in here or one side or in the middle, or it actually goes down to your legs? It can be different, right? And what causing them? We're gonna talk about what causing back pain tomorrow. All right. Today is symptoms. We're gonna focus on symptoms. Right? Symptoms. I'm gonna share with you my case. One of my case I treated her the day before, which is today is Friday, which is Wednesday. All right. Hello, how are you? Can't read your name. V Dacia Vet. Thank you for joining us. Now, if you're up on this live, joining this live video, please say hello to me and give me a thumbs up. Okay, give me a thumbs up. And tag your friend or your family of your practitioner, tag your colleagues into this live video. Okay, let them know you're watching this live video and share in the end. Please share. If you're on Facebook, on Instagram, please share to your friend. Share this live video to your friend, right? To your family. Share on your profile. Share on your Facebook page. Thank you. Hi, Eric. Good morning. Good morning, Veronica. The monk thanks you very much. His swelling toe has gone down. Oh, that's great. Good. That's good news. Thank you for bringing me good news. Yeah. So it was just explain to what's going on. Veronica say the monk thanks you very much. His swelling toe has gone down. That's because he suffered from gout arthritis on the toes, right? Yeah. Okay. He took blood tests, but no urine acids. Can it be liver imbalance? Can by way it helps? It can. It can. It can be. Well, if let's see, it is a toes joint issue. It's always gonna be with liver, right? That's fun. First thing. The secondly, it can be any other organ that causing the problem. And I don't know. It can be five organs, all the organs related to. I don't know without access to him and ask more questions and take polls, things like that. Um, but if the urine acid test, blood test is normal, which mean it may not be a urine acid issues. It may be just arthritis or infection, right? Infection. The other type of arthritis, it can cause burning and swelling as well. If he has urine acid issue, gout arthritis issue in the past, then maybe no, I won't put it that way, because normally if it's from urine acid, and normally the test will will show that uterus is high. Yeah. So I don't know. I really don't know. But hey, what your strategy? By Hui 8, shooting for all the organs. It shoot for all the organs. So yeah, it's a great strategy for it. If we don't know how to diagnose, I mean, if we don't know what's going on, always treat the all organs, because we know as we age, all organs, all organs, you know, start to get imbalanced. They all fall. No pain now. That this is the second time. Okay, this is the second time. Yeah, you need to get a further investigation about this case. Why, you know, happened second time? Yeah, a good question. I don't know. I may run some tests to see whether there's any other, you know, like rheumatoid arthritis. You know, is there any factor in the blood? That's something, right? And or it may just an infection. That the second time it can be an infection as well as any insect bite. For that, you know, you have to rule out a lot of things before you could tell. Okay, now, yep. If you are on this live video, please share and like and tag your friends. Remember to share, okay? And say hello to me. Like Veronica and Eric always say hello to me. Thank you very much for you're my top friend according to the Facebook. Thank you very much. All right, let's start talk about the back pain symptoms. Okay, now most of us probably think about, oh, back pain symptom. All right, must be pain. No, not really, not really. Why do I say that? Because pain is just one of the symptoms, but when we talk about back pain, it includes uh, stiffness, tightness, and numbness that is in the back. Now, it doesn't mean that you just feel pain and that call in your back and that call back pain. Okay, our back pain in my idea. Okay, I don't care about the others. In my idea, back pain, and then with a lot of patients as well, they say, "Oh, I have backache, I have back pain," and then when you really ask them, can you show me? They said, "Oh, okay, I don't know where it is. I can't touch it." They can't find it, and then say, how painful is it? Oh, it's not actually a pain. It's actually just uncomfortable. You know. So the definition of pain for everyone's different. Okay, and the pain level, like how much pain level could you cope with? How high is it out of 10? For everyone is different, and not everyone can actually properly describe the pain level, and not everyone can probably describe the type of pain. Okay, this is something that we need to talk about today. Got a bit cold here. All right, let me turn on the heater. Okay. Now, the back pain symptom. Okay, it can have many symptoms that including okay, a dull ache sensation in lower back over here. So when we say the lower back is on the lumbar and here, the green one, lumbar. So it can be in here as well. Some patients say this is thoracic, but some patients have pain in there because it's so closer to the lower back. So they say, wow, my lower back pain. When they show you, it's actually in lumbar. You go and count. How do you get to lumbar? Okay, if you're a practitioner, you know it. So from here, you touch here. I just show my daughter how to locate L4 the other day because my wife wanted to get some treatment of acupuncture, and my daughter in charge of that. She sometimes put needle for my daughter. No, my daughter put needle for my wife, and my wife came to me and said, well, can you show me how to locate L4? And because she wanted to treat her Mingmen. Mingmen is kidney point, right? So I taught my daughter, so if you get to the side of here, so bony, above the bony area, so this is the bone you get to, and right across over here to the back. So in the same level, you get L4, which is lumbar 4. And then you go, because this is all pointy, pointy like this, it point up from here. So if you get your fingers push and down, oh, you feel one pointy bit, second, third. So how do you work out it? You get a pointy bit, and you go above, oh, another pointy bit, that is 4. Another pointy bit is 3. So in between here and here, there's a bit hollow. It's depression, okay? A bit of depression in there. You go ahead, oh, go down a little bit. Oh, that's another pointy one. That's 3, okay? And you go, as you go up, up there, you go, oh, there's another hollow. Oh, there's L2. Then L2, down there, there's L4. Mingwen, right? So you keep going, then you can reach 12 and 11. That's thoracic. T, 12 and 11, right? That's T. So some patients, when they have pain in here, and you always go down there and try to work it out, and okay, it's actually thoracic. It's not a lower back, but patients say it's my lower back. Okay, it's actually much higher. It's actually on the thoracic. But there's no difference. This 12 and 5, 7. So we separate them. We make different name according to the human. Okay. While from other world, probably we don't say it. It's just, oh, it's all thoracics, So it's just a name. So normally we give a definition of lower back is according to the spine vertebrae. 5 of them in here, the green one that you can see, that's lower back. Right. So, but you need to be aware of, patient may say this is the lower back in here, which is much higher, and say in here. Yeah, it looks like lower back though, but it's actually in here it is thoracic 11 and 12, right? But that's okay. That's okay. Just be aware of that. Okay. Now the pain, it can be a dull ache, and it can be a stabbing. What's stabbing? Stabbing is something you get a pain, a stab on it. It means quite sharp. It's quite sharp. All right. That can be that kind of pain. It can be what? It can be just shooting pain. Something like that. So some patient will say, oh, it's just like needle, prickly, prickly, like a lot of needle, like you get a needle and tap it on the back. It can be that. It's not a stabbing, it's not a shooting, it's not that sharp, but it's not very high pain, but it's shooting. It's prickly, it means a lot of needle on top. It's very different with shooting and stabbing, right? So this is another one. Now, the shooting pain in generally it can be stay in one side or in the middle or across. Okay, and it can be go down to your legs, radial to your legs. Okay. Now, pain, it can be weakness in the back, like patient without any pain, and patient just feel uncomfortable. They can't say this is a pain, but they have weakness. They have not just uncomfortable, but no pain, and they can't move. They can't stand up because of the back. There is no strength. Yeah, no strength in the back. It can be that as well. Okay, then with the pain, because of the pain, it can restrict your range of movement. What is the range of movement of the lower back? Is bend forward. Okay, if I'm standing up, you may see properly. So bend forward, right? Backward, that is a range of movement. And what else? Sideways and sideways. Okay. And the others is if someone behind you and call, hey, Szenan, and you have to turn back, you know, rotation this way, right? So here, no, do not move your, yeah, it's just rotation. So some patient they get pain. So this is the test out as well. Once you understand the range of movement of patient, then when you treat your patient, before you treat the patient, or if you're patient, that you can test it out, what movement can you do and what movement can you do and what movement when you go to that movement, you get pain, right? You get pain. So pain, back achy, it could limit your range of movement. It can limit your back exercise, all right? So let's have a look. So the pain level that we the pain description, sharp pain, shooting pain, or sometimes people say throbbing pain. It can be throbbing too, it can be throbbing too. Dull ache, numbness. It can be numbness. It can be what? Prickly, and it can be tingling. It can be tingling as well in the lower back. Okay. Now, apart from pain in the lower back, it often pain goes down to your uh, buttocks, or it sometimes goes to the top thigh. It can be going down to your knee as well in the front. Okay. It can be going to the side, just the side, or to the calf, or the side of the back, or in the front. It can go to the foot or your toes. Okay. Sometimes it just stay in one, sometimes stay in the others. Okay. And I want to point out to you, and there is some pain in the lower back. It can relate it to your neck. Patient feel pain in here, and at the same time, the pain actually shooting up there. Very rare. Okay, I have 2 cases in my memory. There are 2 cases that the patient complained pain in lower back, then the pain and generate a pain travel, down to your leg. But in these 2 cases, they come different time, of course. They are not friends. They don't know each other. But the pain actually shooting up to the neck. And that can happen. Very rare though. For the last 13 years, 14 years of practice, I only have 2 cases that in my memory that I can remember, that a low back pain actually shooting up to the neck pain, causing neck pain, and one of them causing headache as well. As from lower back, it started from lower back, and when they came in to my clinic, they still have lower back to the worst, and you would always think about, asking the question where the pain's going down to the leg or not, tingling, numbness or not. They said no, nothing, but the pain go down to the neck and causing headache. Only 2 cases, but that's very rare. Just mention it to you. Anything can happen. Now, not every patient or every case is the patient describes the back pain exactly like the textbook. Okay, no, you won't expect that. Okay, do not expect that. So if the back pain symptom, that may indicate some serious problem though. So let's talk about what symptom it will indicate what problem. Okay. In general, okay, what we said yesterday, the back pain patient, they can. Hi Amida, how are you? A lot of people have it, about 75 to 85% in according to America data. 75 or 85% in their lifetime they have back pain, they suffer from back pain, and about 50 of them, 50 out of the 75 to 85%, they they suffer from one back pain yearly. So every year they get a back pain. So which means a lot of people though. So if we put it that way, that is about 32 to 42% of a normal people. 100 people, they have 32 people or up to 42 people that have back pain yearly. That's pretty high, actually. That's pretty high, isn't it? Okay. That is why physiotherapy, chiropractor, osteopath, and massage therapy and acupuncturist, we all see back pain patients, and that's very, very common for us, isn't it? Okay. Now, according to the symptoms, okay, all back pain can heal itself. It can, okay. Back pain can heal itself. Some chronic back pain in patients just have stiffness in the morning, and as they work, they got better. So what does this sound like? Arthritis, okay? And people don't care about it because it doesn't actually stop me doing what I want to do. It doesn't slow me down my work, you know. And if this back pain, stiffness in the morning or achy in the morning, as they work, they got better, or it hang in there the whole day. And what a simple thing for them: take some medication, some painkiller, and they take it if you're okay, and they can carry their work no problem, and they just do it daily and for years. And what happened is, we will call it a chronic back pain. Then what happened next? It get progressively getting worse of this symptom until it actually stop patient or slow down the work, the daily duty. Okay, they probably can't do something, or they pick up something, it get worse now, and they can't go to work. They're not sleeping well. They're not sitting prop. They can't sleep for sitting at work. It's so painful and make them miserable, annoying, frustrated, and they get anger to family or children or husband often. Then they start realize, okay, this back pain is not healthy for me, and I need to get someone to look after that. So therefore they call you. Okay, therefore it's a very common that we heard about all this, you see. If back pain doesn't stop them or preventing them do something, hey, most people, think about yourself as a practitioner, or think about you if you are a patient right now. Is it your case? Most of the case, yes. No one will have a little bit back pain and just call and I need a treatment because I have a back pain, or it hasn't stopped me doing things yet, but I want to get it fixed. Very rare. Unless those patients have back pain, they they're actually like they doing sport a lot. They go for biking and they want to prevent the pain getting worse, and they will come to you. Okay, mostly we see on this, and don't expect elderly patient to come in. If you're elderly uh, uh, um, person and you get back pain, normally they just suffer from it. Oh, that's nothing, because they do nothing at home. They don't do much at home. Not they do nothing, they don't do much at home. So they just try to live with the pain. They're trying to, okay, but it's not successful most of the time. Now, if you have symptoms, if you're a practitioner, you need to know this. If you are not a practitioner, you need to know this too. If you have symptoms that losing control of your bowel or bladder control, okay, it may not necessarily that you have a lot of pain, may not necessarily that you have pain down to your legs at all, okay? But if you're losing control of your bowel or bladder, then you need to go straight to your practitioner. I'm not sure about physiotherapy, chiropractor, or osteopath, but acupuncture can do something for it. Okay, I just have a case, not myself, because I give lecture for 5 back point and medical 12 back point for back pain, for any kind of back pain, for structure change as well. And I had a student uh, in China who just text me and said, "Thank you for giving this lecture. I have a patient walking with a lot of pain in the lower back and who can't control the bowel and urine." And he straight away put needle in, and the patient stand up without pain and go home and realize that the bowel and bladder control is better, and keep treating for 2 weeks. Of course, with Chinese herbs, not just acupuncture, right? Keep treating, but at first get immediate relief, okay? Then he got better. Patient got better completely after 2 weeks. But I just want to share with you that acupuncture may treat the bowel and bladder loss control when it comes to back pain. But according to textbook, according to textbook, when we learn, our master said, as soon as you get a patient get bowel and bladder not controlling properly, send them to hospital because they need operation. It's not what we can treat in acupuncture, but that is not truth. That is not truth. I want to reassure you that's not true. You may be, if you're a practitioner, you may be thinking of, oh yeah, it's something that we can't treat. Give them needles. It may help. I'm not saying we can treat every of the cases. Okay, it may help. If it helps, like this student, put needle in, it actually get instant relief. Then talk to patient. We may be able to help you. You may not need a surgery. If you want to avoid surgery, let's try it. And you may just using acupuncture to treat them. And yeah, I have one case too in my mind that I remember that is very not much pain in this cases. Like in the student cases, a lot of pain and lost control of bowel and bladder, right? The cases I have, not much pain, just a bit of tingling in the lower back and losing control of bladder, but not about bowel motion. Bowel motion is pretty good. Losing control of bladder, but he liked playing guitar. When he played guitar, and after that he found, oh, my pain's weight, and didn't even realize that he pains weight often. Okay, so we use acupuncture, and I actually didn't put any needle on the lower back. I treat the organs, and it got better. He says less and less of weight pain, then eventually it got better. So acupuncture. He was old. He was about 70 something. Then because of this symptom and not giving him a lot of pain in the back, so the surgeon said, nah, I won't give you surgery, because he said you're not suffering from a lot of pain. It's just lot control of urine, right? So when nappy, so adult nappy, right? You can weigh this. So they said, well, no operation because you're too old for it, 70 something. They're not comfortable and no confidence for him to get surgery. So surgery is not 100%. So you need to be aware of that. So I did help him, and I gave him acupuncture, and it was fine. No herb for this case, just purely acupuncture, and got better, completely better. Right. So I want to share with you as an acupuncturist. If you're an acupuncturist, You know, this is all hard case. And according to the Hi Happy Day, how are you? Textbooks, you need to send all this patient to the hospital, the emergency specialist, and be prepared for operation. But I'm here to share with you and give you example and talk to you. And hopefully, if you have this patient, try acupuncture first before you send them straight away to operation. Okay, believe in your acupuncture first. If it doesn't work, hey, go for operation. Right. So numbness, tinglings, and weakness on both legs. So numbness and tingling. Again, this, if you're patient, you need to see a practitioner, Chinese acupuncturist, physiotherapy, chiropractor, or osteopath, or your medical doctor. Why is that? Because when it comes to numbness and tingling, that means that compress the nerve. Okay, nerve compression. So it can be a big problem, right? Right, or weakness. You don't have strength in the legs, and that's important too. Okay, you need to find your practitioner to check on it. Okay, and further on, you might need an MRI or X-ray, you know, to investigate what's actually going on. Right. Of course, we do a physical test for you in general. We will talk about physical all the tests in the next couple of days. Now, if you have a trauma, you know, such as a fall or you know fall down or accident, car accident or direct contact, uh, like rugby, you know, and they may not have pain while they playing on the spot, but the pain can come afterward, and it can be serious pain. So in general, if you have a trauma, accident, sport, car accident, motorcycle accident, uh, mountain bike accident, hey, if you suffer from back pain because of that, I would suggest you straight away go to your doctor, acupuncturist, um, um, chiropractor to get it fixed. You know, to get access to help earlier rather than later. Okay. Um, if the pain level on your back that's intense and it's constant, that it get worse at nighttime, that when you go to sleep. Now you can't go to sleep, you can't find a comfortable position for it, then yes, I would suggest you to get acupuncture straight away to help you. And as an acupuncturist, if pain that happen at nighttime, only at nighttime, or it got worse at nighttime, I always show my patient some acupressure point that can work and relieve the pain from the lower back, so patient can sleep at nighttime. Sleeping is the very important thing. Why is that? If back pain prevent your patient go to sleep and they get miserable, and they actually make the pain worse, 10 times worse. Okay, 10 times worse. Now, if any pain that in the lower back that associate to your lower back, pain can go to lower back, lower abdominal, or not just lower abdominal, can be stomach as well, and make you vomit. Okay, if any of this case, go to emergency. Why is that? Because it can be kidney stone. If pain on one side is very painful, then travel to stomach, a lower abdominal, and make you disease and vomit and or nausea. Then what happened? Go to the emergency. Yes, you can see acupuncturist, no problem at all. But this case, go to emergency because you may have kidney stone. right? The pain can be stabbing pain, throbbing pain. It may not constant. It may be constant. It may just go and comes very intense and goes and comes very intense. Okay. If it got fever with lower back, it can be an infection. Then yes, see your doctor. But what I just mentioned, all this pain, it can be blah 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 blah. You know, all this pain, Chinese medicine, acupuncture may help all this symptom. Now, I don't know about the other practices, massage therapies, it may not help further. Okay, but people love massage because it's comfortable. People don't like acupuncture because it's a pointy thing that looks scary. And when you hear about it, oh, to do with needle, oh, no way, Yeah, but acupuncture can do much more than massage, right? They can do much more than massage, okay? But as I said, when you lost your control bowel, and if you have pain in lower back and associated to your tummy, make it warmer. If there's a kidney stone, then we still have idea to treat it. We use acupuncture. What else? I give herbs. So I give herbs to my patient to pass kidney stone. Then they use acupuncture to limit the pain, reduce the pain, and then you give them help to help them pass kidney stone. Passing kidney stone is one of the treatment that acupuncture and Chinese medicine can work together. And people think that passing urine kidney stone, you have to go to the hospital to do that. If you go to hospital, most of the time they give you what ultrasound or CT scan and find out, and they send you home and say, well, you need to pass it out naturally. They won't do anything. But some they do laser to break it down. But again, not everyone. Not everyone. If it's a small one, you're in pain, they give you painkiller and send you home and hey, drink more water and to pass it to one to pass it to, and it's fine. You see bleeding in your urine though, and that's lower back pain associated with caused by kidney stone and associated with the tummy pain. Right. So all these things that we just mentioned, acupuncture and Chinese herb, both work together, are very good for them. Okay, that's it for today. Now, if you have any question, please put down the question down there below and ask any question that you like. And let me know if you have any question, and let me know whether you enjoy my talk or not. Okay, so I'm Szenan from Center of Balance, the acupuncturist. Now, if you're a local patient or you want to find help or acupuncture, we are available. We're in Dunsdale, Hamilton, in Cambridge, in Auckland. So you're welcome to come to us and get a free pre-assessment. All right, stay awesome for all acupuncturists. If I just go smoothly every topic, we just talk about of my case, my experience, and my memory. Some cases probably a long time ago, and like with kidney stone or loose bowel or bladder control, and we don't get it every week, to be honest. All those cases very rare that it happened to us, and yes, we treat it with acupuncture and Chinese medicine. But as I say, when it comes to all the severe case and people, even you as a practitioner, you doubt yourself whether acupuncture can help or not. Do you think acupuncture can help? Though you don't know, not until you start to treat them. So be very clear to patient. Let's work it out. Let's try acupuncture. The first thing we need to try is, does acupuncture work for you? Do you respond to acupuncture? That's the first thing. Second thing, if it works, how long does it last? You work it out first. When you work out, yes, acupuncture is working. Oh yes, it lasts for only 2 hours. It lasts for 24 hours, it lasts for 2 days or 3 days. Then you set a proper treatment care plan with your patient. This is, yes, we tested the acupuncture work now. You can feel it, you know. It's a subjective issue that the pain, because your patient feel it, you can't feel it. Okay, you can't feel it, and you may see it. The range of movement become better because of acupuncture treatment. Then, if the pain um, lasts for 24 hours, then ask the patient come 3 times weekly or 2 times weekly and show them some acupressure point so they can help use that acupressure point to relieve the pain at home. So that is important. Thank you, Szenan, for your valuable knowledge you give to us. Have a great day. Thank you, Veronica. Amina, please teach us the 8 point. What 8 point are you talking about? Thank you, Eric. What if the pain is in one side of the ribs down to the lower back? Then it's simple. It's just do acupuncture 1, 2, 3. You know, there's a video. Happy day. All this question of happy day is very simple. Okay, go to acupuncture 1, 2, 3. You need to know which meridian is sixth meridian, and then what sixth meridian, and find the balance meridian, and then find the points. Okay, so all this from the ribs to the lower back, we treat it the same according to acupuncture, right? According to acupuncture, then you need to find out if the rib pain over here on the right side going to the back, right? You need to consider whether it's a gallstone issues, whether it's a liver issues. Okay, if on the left side, you need to be aware whether it's a pancreas issues or spleen issues. Okay, and both sides, different side. You know, then we have a video, your practitioner in our platform. Let me send you a platform. On the Hype platform, then you can go. There are free webinar about acupuncture. Let me find out for you. Okay, there are free webinar in here. Acupuncture 1, 2, 3. So go ahead and log in and create you an account. The free webinar, and there's about 2 hours webinar, and please go and watch the video and learn it yourself. And all this pain that you just mentioned, it can be very simple, just acupuncture 1, 2, 3. Then you get instant relief from it. So thank you. I'm in the US. I would like to have a treatment in a class to learn the technique. AcuGap, we actually have webinar that is talking about teaching. I was teaching in local balance, which is acupuncture 1, 2, 3. It's very good for pain relief. If that is something that you want to, I will send you the link. Let me send you the link. Send you to sign up. Webinar, which is acupuncture 1, 2, 3, and local balance. Yeah, let me send to you afterward. Can you private message me on Instagram? I'm not very good with Instagram, but I'm trying to get familiar with it. Okay, So thank you very much, and I'm Szenan from Single Balance, and I'll see you tomorrow morning. Stay awesome, and I love you all. If you want to learn more about herbs, I haven't got any webinar for herbs yet. My herbs are very different. I use posts to